2025 has been a big year for computer chips inserted into patients' brains to help them with devastating conditions. But these early versions are bulky, use physical wires to connect with external devices, and require invasive surgery. A team of researchers just demonstrated a new version of this tech that's tiny, wireless, and packs in dramatically more electrodes than anything else out there. Hi, I'm Ryan Flynn. I write about healthcare and medicine, and this story comes from a recently published study in Nature that I saw and found really interesting. So what makes this device different is that the entire chip is thinner than a human hair. It's flexible enough to slide between your skull and your brain, resting on the surface like a wet piece of tissue paper. It sends signals wirelessly through the skin to a head-worn device with no cables penetrating your skin. And it's packed with more than 65,000 electrodes on a single chip, roughly the size of a fingernail. To put that into perspective, other existing devices like Elon Musk's Neuralink implant has about 1,000 electrodes. Other devices that are wireless brain chips have between 16 and a few hundred electrodes. This new device has more than 60 times more than the others. More electrodes mean that they can map brain activity across the surface in much finer detail. Think of it like a resolution on a camera. 12 megapixels captures much more detail than 2 megapixels. The same principle applies here. More electrodes can pick up signals from more neurons, giving computers a cleaner picture of what your brain is trying to do. That could translate to faster, more accurate control of prosthetic limbs, better seizure detection in epilepsy patients, or more natural communication for people who can't speak. The wireless aspect is crucial too. Current devices either require cables coming out of your head connected to external computers, or they use implant canisters the size of a coin to house the electronics. Those canisters typically require a moving part of the skull to make room. This new system eliminates both of those issues. A device is worn on your head when it powers the chip wirelessly and can stream brain data across more than 100 times faster than other wireless brain chips. Right now, it's kind of bulky, this external device. It's about the size of a deck of cards because researchers had to build a prototype for the study from off-the-shelf parts. But they said that they can shrink it significantly by designing a custom chip for future versions. In tests on non-human primates, the device tracked eye movements and identified perimeters and patterns that they corresponded to what the animals are looking at. So they showed that it does demonstrate that it works. The researchers also showed that they could remove and replace the chip without major additional surgery, which means as the technology improves, patients could get upgrades without complex procedures. Now, the device hasn't been tested in humans yet, and though initial surgical studies are underway, and scientists still need to prove that it can actually help patients with the conditions better than existing treatments. But it's in the works, and the implications are significant. More than 5 million people in the U.S. live with paralysis. Millions more have epilepsy that doesn't respond to medication, and current brain-computer interfaces simply aren't practical for most of them because of the surgery required and the risks involved. So this technology has the potential to really help many more people. Thanks for watching, and let me know what you think in the comments.